Hello everyone, Dr. Shoba, Senior Gynecologist from Cytecare Hospital. January is Cervical Cancer Awareness Month. Cervical cancer is the second most cancer affecting Indian women, following breast cancer. Cervical cancer is due to a virus called as Human Papillomavirus, which is a sexually transmitted disease. So, do all sexually active females get cervical cancer? Not really. So, who are the women who are at risk of developing this cancer? So, there are certain risk factors which has an important role in progression of this HPV infection going into cancer. So, whenever a woman has a persistent HPV infection, definitely she is at risk of developing cervical cancer. So, what are these risk factors? So, any girl, the age at which she has started her sexual activity, if she has started it early, the risk is more. If she has conceived and delivered a kid early, then the risk is more. So, any early sexual activity, early conception and delivery means before 18 years, then that risk of that girl developing cervical cancer is high. Then a person who has multiple sexual partners, be it a lady herself or if she's having a husband or a boyfriend who has multiple sexual partners, then also the risk is for the lady itself. Then any other micronutrient deficiency, like folic acid deficiency, then vitamin C deficiency, vitamin B12 deficiency, all this has an impact on the local immunity of the cervix. So when the immunity is not there, then persistence of this HPV infection will be there, and this persistence of infection over the years will progress on to become pre-invasive cancer and then cervical cancer. So how can we prevent this? Yes, first thing is we do have something called as primary prevention. So where we talk about educating people and creating awareness amongst the community, etc. Then we have a vaccine against this virus. So Human Papillomavirus vaccine is there, where this vaccine should be given to adolescents before they start their sexual activity. That is ideally between the age group of 9 to 14 years. So even single dose, if given before 15 years, that is sufficient enough. If given after 15 up to 25, 2 doses to be administered. So it has got no side effects and no long-term effects are there. So it is a safe vaccine which is effective against this virus. Then a secondary prevention is there, where all females after the age of 25 years, they undergo a screening test called as Pap test. It's a cytology, like take the smear and then examine, that's a Pap test, or HPV DNA test, where the test is conducted looking for the presence of the high risk virus. So these two tests will help in categorizing a female whether she is at risk for developing pre-invasive cancer or invasive cancer. And if at all, if any abnormality is detected, then and there it can be treated in simple manner itself. It doesn't require a radical surgery or radical chemo radiation. So simple local treatment would suffice. So this is very simple about cervical cancer prevention, but though it seems simple, still many of our female do not come forward for these tests. They hesitate, they have a kind of fear, or they ignore. So these things, I think beyond these things, a female should think about her health and try to get into these screening programs, or get the youngsters to get vaccinated, because every 8 minutes a female dies because of this cervical cancer, and definitely we should do something about it. Since it is a preventable cancer, the best is to prevent it, or if not, at least to catch it in the pre-invasive state itself and then treat it, so cure rate of that is very high. So ladies, kindly take care of your health.